As a nurse, you're in a good position to recognise problems and identify patients who would benefit from a medicines management review. These reviews can help identify medication management issues such as, does the person understand what the medication is and why it's been prescribed? Are there discrepancies between what has been prescribed and what the patient has? Are side effects being experienced? Does the patient have any allergies or sensitivities not listed? Are there any administration or adherence problems? Do medication aids or supports exist that can assist safe self-administration? Is the medication still required?
So Tom, I've just been having a look at the medications that you're taking. Can you tell me what you take them for?
All of them, like the blood pressure tablets. I take.
Which one is that?
It starts with an A, I think.
Okay.
No, could be an S.
Okay.
But there's one for the blood pressure, and I know it's the bigger one.
Okay. And what else are you on?
Then there's the one for the fat, the cholesterol.
Okay.
And that is that either starts with an A or an S.
That's okay.
Yeah, and it's a smaller one. And then there's one for what is that other one? Oh, no, there's the other things that I take. There's the one for the St. John's warts.
Okay. So that's not being prescribed by your doctor, that's just something you're buying down at the chemist?
Yes, down at that chemist, because someone said to me it could make me feel better.
Okay.
Because I was a bit sad when my wife passed.
That's understandable.
Yeah.
Are you taking anything else over the counter?
Yes, I get some multivitamins.
Okay, what sort do you take?
Mouldy ones.
Okay.
I can't remember the brand, but
That's
the guy
okay.
across the road said I should take some roids, and down at the chemist they said you can't have roids, you've got to have multivitamins.
I'm glad they said that.
That's right.
Is there anything else, Tom?
No.
Okay.
For example, a common problem with medication delivered by inhalation devices is that patients may not have a good technique and hence do not get an adequate medication dose. If you can get them to demonstrate how they use their inhaler with you, a teaching opportunity may present itself or an issue can be flagged for future follow-up.
Show me what you would do with your inhaler when you go to use it.
Put it in my mouth and then I press the button and breathe in.
Okay.
And that's what I do.
So what I would suggest you do is press the button and make sure you can see that it's green before you go to put it in your mouth. Okay. Then you pop it into your mouth. So this is my demonstration one. Watch me, and you've got to make sure you seal it really well and breathe in fully. Now you can hear the click and you see that it's turned to red, and that shows you that you've taken your dose. So I can email you some information, Tom, and there'll be a link that will take you through to a demonstration video. Do you use that email that you provided us with very often?
That's the intraweb, isn't it?
Yeah. So are you happy if I send you some information via your email?
Yes,
Okay.
I know how to use that.
I might just give you a printout of it as well.
Yeah. Genuair.